I guess, common muscles. All right, so let's start here with the facial muscles. There's a couple groups that we need to keep in mind here. Let's do it by section. So we'll do head, we'll do neck, we'll do chest, anterior, posterior, and then lower limbs. So let's start out with the facial muscles here. I'm seeing number 1 right here. This is a muscle that's located in the frontal aspect.
Frontal.
Not the frontal, the frontalis.
The frontalis.
Frontalis, right? So you can see these vertical lines that are found here. Okay, this is the frontalis. It connects via the aponeurosis to the posterior aspect of things, which is number 3 here. This is the occipitalis. Sometimes we call this the occipitofrontalis, right? This entire thing connected by the aponeuroses, okay? This one right here I think is number 4. Overlies the temporal bone. So what do you think this muscle is called?
Temporalis.
Temporalis. And if you can wiggle your ears, there you go. Kathy's got it. She's wiggling her ears. This is the muscle you're can you do it?
No.
That's the muscle you're activating as you wiggle your ears. Okay, the temporalis. All right. So now let's go back to the anterior. Anterior, we've got number 7 here. It overlies the nose. Nasalis, right? The nasalis muscle. Okay. This muscle right here, you've got a circular aspect to it. Orbicularis oculi. Okay. Then you have this muscle up here. I think it's number 6. Number 6, and this allows you to furrow. This is the one I always talk to Monica about.
This one?
That one. There you go. The vertical lines that you see when you're mad or upset, that's the procerus. Procerus muscle. Okay? So we've got the procerus, we've got the orbicularis oculi, the nasalis. Here's another muscle, and again, you have to imagine it going over the entirety of the lip.
Orbicularis oris.
Orbicularis oris. Oris means mouth, basically. So the orbicularis oris, orbicular, meaning circular. So it's a circular muscle. It's the puckering muscle. It's the kissing muscle, right? This one right here, number 10. Then you have number 14. What do you guys think this one is? 14 is going to be found underneath the lip. So Latin depressor, labii inferioris. Why?
I know the third one.
Because it's inferior, yeah? So depressor labii
I remember
inferioris.
because you said it makes the lip go.
This is the one that when you do this, look.
Oh, it's the
Yeah. That's how I remember.
Please give me an A. No. Then I'm going to smile with my risorius muscle and be like, no. So that's the depressor one. The depressor labii inferioris. And then this one right here, which I think is 16, the one that's found right here on your chin, the thinking muscle. The mentalis,
Oh,
the mentalis, right? Like the thinking man. You ever see that sculpture of the thinking man? His hand is over his mentalis, his mental region. So the mentalis. And sometimes when there's a defect in this muscle, what do you get? You get a cleft chin. Yeah, which some people might find attractive. Yeah, the cleft chin. Depending. Some people are like, some people are like, So, personal taste. Same thing with another muscle that we'll take a look at. Well, let's jump to it right now, which is up here. These two regions right here. You've got a zygomaticus major and minor right here. And basically both of these muscles, they're going to assist in facial expression and smiling. And like I said, if there's a defect in this muscle, you have a dimple. Yeah, so you have a dimple. I don't have one. I don't, yeah.
My daughter has them.
I'll smile really hard. I'll make one. It's a defect, basically, of the, what muscle is it? Zygomaticus. So that's this and this, okay? So now we have this one right here, number 15. So look at the yeah, and look at it, it's an angle. So what do you think we'd call it? Depressor anguli oris. Does that make sense, right? Depressor anguli oris. So what's that one do? It brings the corners of your mouth down when you're sad face. Like, no, he didn't give me a good grading. Didn't get an A.
I got a C in lab.
I got a C in lab. Okay. That's the sad muscle. Okay? The opposite to that would be what? What would be the opposite? So you got an A in lab now.
I do?
Well, yeah, there you go. So you're smiling. Yeah.
Risorius?
Risorius is one, which is what? I think they cut it. Right, I think this is the risorius, no?
Yeah.
No, that's that's going to be back here. This one right here, which is number gosh, I can't see from this.
Is it buccinator or buccinator?
No, buccinator is 13.
Buccinator is deep.
I don't want to go into the mastication muscles yet. I'm talking about 11, which I think is your risorius muscle.
Yeah, it is your risorius.
Yeah, that's a smile muscle basically. That's going to allow you to pull up and smile basically. Okay. There's an opposite to everything, but we're not seeing it all because the mannequin is only, you can't pull off other muscles. Right. So we can't see the other muscles that are deep to that. But yeah, that's the risorius that we're talking about. The zygomaticus. What's this one down here? This is the one I was telling you guys earlier. Oh, yeah. I was going to say, this is the muscle that covers everything, right? That protection muscle.
Yes.
So you have to remember, when you do cadaveric resections or dissections in a real person, you're going to have a giant muscle that's
Way
basically,
bigger.
yeah, it's going to be a really long muscle that extends all the way over here. And the reason for that is because it's going to protect all the underlying structures, like another layer of protection, and that's the platysma.
Okay.
So when you initially do your resections, you'll be like, where's all the muscles? All I see is this giant muscle right here.
Right.
You're going to have to think to yourself, oh, that's the platysma. I have to resect that muscle, and then I get to the deeper muscles,
Got it.
like the sternocleidomastoid, for example,
Mhm.
which is everyone's favorite muscle. Not everyone's, but it's a popular one because you can see it easily. Very good. So we were talking about that one there. Now let's take a look at the mastication muscles. One of them we already looked at, which was the temporalis.
Mhm.
Another major muscle for mastication is this one that's going to overlie the mandibular bone, and that one is called the masticar, no? How do you say masticar?
Yes.
Chew. So what do we call this muscle?
Masseter.
Masseter, right? The masseter muscle. Then you've got another deep muscle, a deep muscle to your zygomaticus and deep to your risorius. You've got your whistling muscle,
Buccinator.
the buccinator. This is the one that allows you to pocket food on the side of your, you know when you're chewing and you
Mhm.
put food to one side?
Mhm.
That's the buccinator you're using. Or you got like a milkshake and you're drinking the milkshake, and that's gonna allow you to pull in your cheeks. Yeah, okay? That's the buccinator. So masseter, buccinator, temporalis. There's a muscle that we can't see here, bonus round, that's not on the sheet as well,
Wow.
okay? That's gonna be a chewing muscle that's gonna allow you to go side to side,
Oh,
side to side. So what is it? Side to side, come
I
on.
remember. Well, I don't remember.
The
it, but I
medial
remember
and the lateral starts with a P, T, pterygoids.
pterygoid.
Pterygoids. The medial and the lateral pterygoids.
Pterygoids.
They're the ones that allow you to go side to side.
So that one's not going to be on.
No, like I said, this mannequin.
Extra
yeah,
credit.
that's-
Oh, extra credit point.
Oh, maybe,
Bonus?
Bonus point?
maybe some bonus points of muscles that aren't visible. See, you had to send me the video so I remember. If not, I'll forget.
Okay.
Maybe I'll give you some bonus points for muscles that aren't visible, but if you guys can list them out, maybe, depending on how much time I have. Yeah, that's one. Okay, very good. So let's see, we got all these muscles. So far, so good?
Yes.
Are we comfortable? All right, so let's go to the back here. Oh, this one right here. This is a muscle, remember, it's gonna be a very long strap-like muscle that's gonna attach down here. Okay, so these are also parts of it that have been cut for us so we can see the internal anatomy. So what muscle is this? A long muscle that originates from the mastoid process and is going to have points at the sternum and the clavicle. Sternocleidomastoid
Mastoid.
muscle.
Mhm.
Sternocleidomastoid. So that's not too hard to remember,
No.
and you just have to remember the pathway of this muscle. It's basically kind of like this.
Mm.
Why do we want this thick muscle at this region? Remember what I told you guys? What's
Protect-
underneath? Look at that right
protect the
there.
arteries.
That right there, yeah, that's a carotid artery right there. You don't want to nick that one. That's the jugular right there, right?
Mhm.
Those guys right there, major blood supplies to the head and then ultimately the brain. So we want to protect it. One, we got that outer layer of the platysma, but the one that's going to be kind of protecting it is going to be the sternocleidomastoid. So when you guys are doing your vitals, that's the muscle you're always looking for to go deep and pull it out of the way so you can get into the actual carotid when you're checking. Sometimes I see students that do pulse like very superficially, and they don't get between that sternocleidomastoid to actually feel the carotid, right? So they don't get to feel it. They basically lie. Okay? I feel it. I like the radial pulse on the ulnar side. I feel the radial pulse. It's the ulna. Okay, so we got that muscle out of the way. Now let's go to the back, the posterior side. Okay, this one's it's not too bad because we have big muscle groups here. We're going to talk about this big muscle right here. What's this big muscle that we're dealing with here? It's long, it's trapezoid in nature. They've cut this section for us here so we can see the internal aspects, but it would overlie the entire aspect of it. It is the most superficial of our back muscles. It's large.
Trapezius.
Trapezius, right? That's the trapezius. We know the relationship with the trapezius in relation to the one that we just saw in the arm, which is the deltoid muscle. So these muscles right here, they kind of comprise or consist of the posterior, the medial, or the not medial, but the posterior, lateral, and anterior aspects, okay? So this is the posterior. So here we go. That's the trapezius. And then we have another big muscle that you guys told me earlier, but here it is in its entirety. What is this muscle? The latissimus dorsi muscle. So when you do pull-ups, if you can do pull-ups, when you're pulling yourself up, you're going to work out this muscle big time, okay? So do pull-ups. No. If you want a big back, basically, you do pull-ups.
Oh.
But you can see, again, look at this wide muscle. Do you guys see how wide it is? But remember in the arm how it was like this little tiny little sliver?
Yes.
Because it forms the posterior part of your armpit. The posterior axillary line, as it's called, okay, on the backside. But all this, the lats. Okay, now you have a couple muscles right here. You got this muscle right here, which is, what is it, M something? This one right here, and then these two right here, okay? We have to keep these in mind. Is this a rhomboid that we're seeing here?
Yes.
Or are these rhomboids? Or are these teres minor, major?
Oh, great.
What are we seeing here? Let me give you the,
bottom ones
let me,
are
this is M,
first.
what's M48 and 47 and 46? 46, 47, 48.
46.
What is 46?
Infraspinatus.
Okay, and then 47?
Teres minor.
Okay, so look, do you guys remember the infraspinatus that we took a look at earlier
Mhm.
in the other arm? Do you remember how we said that's the muscle that's going to be below the spine of the scapula? So if we imagine the scapula is about right here, right, the scapular region, the spine, what's below it again is the infraspinatus. Okay, that's this big fleshy muscle that's deep to,
The latissimus dorsi.
no, deep
The-
to
the
trapezius. This is the
trapezius.
trapezius. So if we imagine, we have to imagine, they cut it for us, but we have to imagine that the trap actually covers
Covers
all
it,
this. Yeah.
okay.
So an intermediate muscle group, if we were to make a little cut right here, we would be able to see infraspinatus and then teres minor and major that are here. Okay. So again, this
Do
one,
those two make up the armpit by chance?
the latissimus dorsi does.
Oh, okay.
Plays a big part. The other two we said play a role in the
The
shoulder
Okay.
aspect of it, the shoulder, more the shoulder. So teres minor plays a role in that aspect, and the major that's found right here, okay? So 46, 47, 48. Does that make sense?
Yes.
Okay. And then you have in the back all these like occipitospinalis muscles, cervicospinalis, right? And what
Those
they
are the ones that come all the way
yeah,
down.
those are, I mean, they don't have them here for us, so I'm debating if I'm going to ask them or not. But essentially, these muscles are going to insert themselves on like the occipital region and go all the way down, let's say, for example, to the cervical region. So that would be the occipito cervicalis,
Mhm,
right?
And then there's lumbar ones. That
The
come
lumbar
all
or
the way.
thoracic ones, they all depend. I may not ask them because we have more muscles, I think, to review.
Yeah.
And this is not the greatest example because you don't get to see the erector spinae muscle group in its entirety. But I would ask you something like this one. What's M50?
The gluteus maximus.
Gluteus maximus. Now, this is a trick question now. Not trick, but sometimes some people get it wrong.
I know.
Which one is lateral, which one's medial?
This is medial lateral.
So which one is the semimembranosus? Which one is the
Right
semitendinosus?
here. Oh, semi. Well,
right one?
isn't it's this one?
Which one's this one?
This is the bicep. No.
They're both bicep from femoris. or whatever.
Femoris.
Are you sure? 51, 52. Both bicep?
Is this a trick
Femoris?
question?
No. I'll ask you. Is it trick to you?
51.
Long head.
Yeah, bicep femoris.
Biceps femoris.
51.
And 52?
That's the semi.
Semitendinosus.
That's what I'm saying. That's what people confuse it with.
Oh, okay.
I don't know why I thought
They,
both
they
were
think
considered.
some people think it's the long head, short head.
No.
But that's what I'm telling you. You have to watch out with that one because one is going to be the actual biceps femoris, and the other part is going to be the
Tendinosis.
tendinosus. Okay,
Yeah.
so don't forget that. Okay, one is the biceps femoris, and the other one is the semitendinosus. So just remember that. The membranosus is a little bit more deep to that. Yeah.
What
Deep
the
to-
semimembranosus is deep to the semitendinosus,
Yeah,
right?
yep.
So it would be underneath it. It
on the
wouldn't be next
yeah
to it.
on the leg you would see it better.
Right.
So you don't get to see that.
No.
But just note that difference in this particular model.
Yeah.
So gluteus max we talked about those. Let's see, let's go back to the anterior aspect of it and let's ask you some muscles here. So this muscle here, M15, this
Pectoralis
pectoralis
major.
major, right? So we can see that it's forming the anterior axilla,
Mhm.
the axillary line, that's the pectoralis major. What's underlying this? What muscle?
Pectoralis minor.
The minor, which we saw a little section of it in the arm. Very good. I think that's about all the muscles. Oh, and this one right here. I think this is M19. You can see it's kind of serrated.
Is that
on the
ex-
side.
Extensor?
Nope, not
Oh,
extensor.
sorry.
Serratus anterior.
Serratus anterior.
Serratus
Serratus. So what does serratus mean? Serratus means it's got like these teeth to it. You guys see this muscle's got like teeth to it?
Mhm.
The serratus, yeah, serratus
Those
anterior.
connect to each rib?
Yeah, they don't, well, they overlie the ribs.
Okay.
They're kind of like fingers over the rib to serve as protection for this region. Because the most fragile part of the rib is where it's convex, where it kind of gives a turn on the side. This is where most rib fractures happen. Someone gets hit here or punched or whatever it is, trauma happens here, you're more likely to get a fracture in this region. So there's some muscles that overlie this part right here to minimize that damage. So that's the serratus anterior. These muscles right here, what are these ones right here? I think this 42 and 43 if we look closely.
Biceps brachii.
Biceps brachii, right on. Biceps brachii, the anterior. So if we just flip them over, the posterior, what would this be?
The triceps brachii.
Triceps brachii. Make sense? And then what else do we have? We got a couple muscles here. What's this one right here?
The tensor fasciae latae.
Tensor fasciae latae. Very good. That muscle right there. So it extends further, no? All the way down to the knee, to about where the knee is. But we're just seeing it here in a bit. And what's this one right here? 53.
Sartorius.
The sartorius muscle right here. Very good. The sartorius. A very long strap-like muscle, right? And then we have 54. What's this one right here?
The femoris longus.
No.
No.
It's femoris rectus.
Femoris rectus or rectus femoris?
Rectus femoris.
Rectus femoris.
Rectus femoris.
It's getting late.